Are you looking for ways to care for your heart health through diet? Watch our video diet guide for cardiovascular patients now. We will provide useful tips and advice on building a nutritional menu that effectively protects heart health. 1. Cardiac diet plan. Choosing fats. Instead of completely avoiding fats in your diet, try replacing unhealthy fats with good fats. Here are some important improvements you can make. Limit saturated fats. Limit saturated fats, mainly found in tropical oils, dairy, and red meat, to no more than 10% of your daily calories. Drink milk in moderation and vary protein sources, choosing fish, skinless chicken, eggs, and plant-based proteins if possible. Eat more healthy fats. Supplement daily omega-3 fatty acids from fatty fish like salmon and herring, or from flaxseed, kale, spinach, and walnuts. Other sources of healthy fats include olive oil, avocados, nuts, and nut butters. Limit red meat. Limit red meat, beef, veal, lamb, pork, to no more than 350 grams per week and avoid sausages and ham. Limit fried fast food and processed foods. Stay away from these foods as they contain a lot of unhealthy fats. Replace saturated fats with unsaturated fats. Use extra virgin olive oil, avocado oil, sunflower, canola, safflower, peanut, soybean, and sesame oils instead of butter, coconut oil, and cream. Foods like nuts, avocados, olives, and soybeans are also good choices. Eat oily fish at least once a week. Oily fish like salmon and herring are rich in heart-healthy omega-3s. Do not replace fats with sugar or refined carbs. When cutting down on heart-risk foods like unhealthy fats, it is important to replace them with the best foods for cardiovascular health. For example, replacing meat with fish or chicken can bring positive benefits to your heart health. Natural sugars. Your body already gets enough sugar from natural foods. Foods containing sugar and refined starches only provide empty calories, which harm your heart and affect your waistline. Choose whole grains. Opt for unrefined whole grains like whole wheat, multigrain bread, brown rice, barley, quinoa, bran cereal, oatmeal, and non-starchy vegetables. Fiber-rich diet. Adequate fiber intake is a key factor in the diet recommendations for heart patients. Fiber helps reduce bad cholesterol and provides heart protective nutrients, while also supporting weight loss. Feeling full longer. Fiber stays in the stomach longer, helping you feel full longer and eat less. Reduce fat absorption. Fiber also helps move fat through the digestive system faster to reduce absorption. Energy for exercise. When your body gets enough fiber, you will have more energy for exercise. Sources of insoluble fiber. Whole grains, wheat cereals. Vegetables like carrots, celery, and tomatoes. Sources of soluble fiber. Barley, oatmeal. Beans, nuts. Fruits like apples, berries, citrus fruits, and pears. Avoid salt and processed foods. Here are some simple ways to reduce salt intake in your meals. Reduce canned or processed foods. Eat fresh foods, choose unsalted meats, and prepare your own dishes to significantly reduce sodium intake. Use spices instead of salt. Instead of salt, try using fresh herbs like basil, thyme, or chives to add flavor. Control water intake. When the heart is not functioning well, unprocessed water intake can be retained, causing edema. Heart failure patients should reduce water intake when experiencing symptoms of shortness of breath and swelling. Patients should drink no more than 1 liter per day and ideally only when thirsty. Besides following a diet for strong blood vessels, heart patients need to monitor their water intake. Avoid alcohol, beer, and tobacco. Alcoholic beverages contain neuroinhibitors that directly harm the heart muscle, worsening the condition. Tobacco contains nicotine, which stimulates the secretion of epinephrine into the blood, causing the heart to work harder, increasing blood pressure, constricting blood vessels, causing breathlessness, chest tightness, and chest pain in heart patients. Balance potassium in your diet. Many studies have shown that potassium is the most important mineral for maintaining heart function. Diuretics, commonly used by patients with heart failure, significantly reduce the body's potassium levels. Therefore, it is essential to supplement potassium through a diet rich in vegetables and fruits such as bananas, broccoli, and avocados. Control your portions. The amount of food you consume is as important as what you eat. Overeating until you feel too full leads to more calories than necessary. To control portions and maintain a heart-friendly eating plan and waistline, follow these simple tips. Use small plates or bowls. Choose low-calorie, nutrient-rich foods, such as fruits and vegetables. Eat fewer high-calorie, high-sodium foods, such as processed foods, fast food, and refined foods. 1. Some foods that are good for blood vessels. Oily fish like mackerel, sardines, tuna, and salmon contain omega-3 fatty acids. This type of fat has been shown to reduce triglycerides and increase HDL cholesterol levels, improve blood vessel elasticity, and thin the blood, reducing the risk of clots and blockages. Certain vegetable oils. Oils such as corn oil, soybean oil, safflower oil, containing omega-6 fatty acids, and canola oil, olive oil, containing omega-3 fatty acids, can help lower LDL cholesterol, when used as a replacement for saturated fats like butter. Fruits and vegetables. The fiber, potassium, and micronutrients, such as antioxidants, in fruits and vegetables help protect against heart disease. Whole grains. A diet rich in fiber from whole grains is associated with lower LDL cholesterol, and a reduced risk of heart disease. Foods high in soluble fiber, for example, oats, legumes, and barley, are particularly effective in lowering total cholesterol levels. Unrefined carbohydrates. Foods with a low glycemic index, such as whole grain bread and cereals, legumes, certain types of rice and pasta, and most fruits and vegetables, also help reduce triglycerides and blood glucose levels, manage diabetes, and reduce heart disease. Legumes, nuts, and seeds. These are sources of plant-based protein, fiber, healthy fats, and micronutrients, which help lower cardiovascular risk. Tea helps prevent fat buildup in arteries and can also act as an anticoagulant, improving blood vessel dilation and increasing blood flow. Foods rich in vitamin E. Some studies show that vitamin E acts as an antioxidant, helping to protect against LDL cholesterol. Sources of vitamin E include avocados, dark green leafy vegetables, vegetable oils, and whole grain products. Garlic. Allicin in fresh garlic has been found to lower total and LDL cholesterol in the blood, reducing the risk of heart disease. Thank you for watching the video diet guide for cardiovascular patients. We hope the information provided has helped you better understand how to choose the best foods for cardiovascular health and how to maintain a heart and blood vessel health diet. Don't forget to hit like, share, and subscribe to our channel to avoid missing any other useful videos from us. If you have any questions or suggestions, please leave a comment below. Wishing you and your family a healthy heart.